The world is currently united in battling COVID-19 and the effects of the pandemic. Technology now, more than ever, has a profound difference in the way that we live our everyday lives and has kept businesses running. And more importantly, it has enabled healthcare and hospitals to stay operational. We often discuss about the healthcare vertical in the telecoms domain, and we discuss use cases, but have we ever wondered what healthcare professionals themselves need from cellular technologies like 4G and 5G? What are the use cases they need to enable with cellular technology? So today with us we have Professor Prasit Watanapa from Thailand Hospital in Thailand, who will share his experiences.
Our Faculty of Medicine is the oldest one. It is now 132 years old. We are now serving more than 80,000 inpatient care. We produce the highest number of research. We have to serve the country. At the same time, we would like to improve our quality in every missions. I mean, in education, in healthcare, and also in research. We go through every information and see what kinds of technology, and then it come up with the 5G platform or 5G technologies. Because of the characteristic of this 5G, the speed, the high reliability, and the low latency, all these three characteristics of 5G fit well with the healthcare. In the past, we had some problem when we send off some imaging study. It takes a lot of time, and sometimes we cannot wait. We have to decide to do something, even we haven't received any consultation from our specialists. But 5G solves their problems. At the same time, in the education, the youngsters who are coming to become our medical students, and they would like to expand themselves to get all the information. I can say that because of the COVID-19 pandemic, it speed up the process of changes. And then when we start using this telemedicine, we can communicate with our patient. We can look after them. We can have some information from them without asking them to come to the hospital. Even at the end, we can send off some medicine to them by using our post office facilities, our delivery system. So we can treat the patient at the same time. We can prevent them from getting the virus. We can use this facility to teach our medical students. Medical education is quite different from other kinds of education. They need to see the patient. They need to look at the slide in order to do interpretation to familiarize themselves with the histopathology. You cannot do this by asking the student come to the medical school and take the risk of getting the virus. So we use the tele-education. We are now thinking more, not only the tele-education or distant education. We are now thinking about, is it possible for our medical students to sit in the same class with students from other countries by using the technology that have the speed, of information, that have a low latency rate, and have a high reliability, and they come up with the 5G as well. At the same time, we got the support from the government to do the precision medicine. Precision medicine, particularly in oncology, you are talking about the big data, the genetic change of the cancer cell. You can find out by using the technology, looking at the genetic information. A big data can be processed within a couple of seconds. Hopefully, within a couple of years from now, we will succeed in using the 5G platform and also the cloud technology to improve the standard of healthcare services of our hospital. At the same time, to leverage the standard of medical education in our Faculty of Medicine.
Professor Watanapa has shared very interesting pieces of information and very important trends that the telecoms domain needs to take to heart. For example, despite our discussions about robotics and remote surgery, it is actually the very simple use cases that 4G and 5G can offer that will improve the daily operation of a hospital. For example, to educate new practitioners or interns without them being able to be physically present in the hospital. Or for example, getting the information from the machines that scan patients and send this data to practitioners so that they can offer their advice or a treatment. This is the feedback that the telecoms industry needs to take to heart. Try to understand what the healthcare vertical needs, not necessarily use cases that start from the telecom side, and try to improve those and then build advanced use cases on top of those. Then and only then will 5G become a true enterprise enabler.